All right, greetings and welcome. For those of you who do not yet know me, my name is Hilary Godwin, and I have the pleasure of serving as Dean of the UW School of Public Health. And usually when we do I say usually, even though we've had them sort of with irregular frequency, but in the past when I've done the state of the school addresses, I've usually focused on the previous year and then sort of what's coming up in the coming year. And this was a unique opportunity because I've now been here for 5 years. So I thought, woo! So I know, very exciting. So I thought it's a unique opportunity to sort of like look back at like what all of us have done together over the last 5 years. So I'm going to tell you about that and then give you a heads up about some of the things that we expect for the coming year. I'd like to start. Come on up to the front, folks. There's this whole row up here in the front. And you just walk right in. It's totally fine. I'd like to start with centering us with a landed labor acknowledgement and to give special thanks to Tess Matsukawa, on whose work this is adapted from. It is vitally important for us to know the longstanding history of where we are and what has shaped the context of the land we inhabit. The University of Washington acknowledges the Coast Salish people of this land, the land which touches the shared waters of all tribes and bands within the Suquamish, Tulalip, and Muckleshoot nations. Land that was stolen by European colonizers. Land that was stolen from those who are still here and continue to honor and bring light to their ancestral heritage. This country was built upon the exploited labor of enslaved African peoples, as well as the exploited labor of underpaid Asian and Latinx peoples. These acts of colonialism, white supremacy, and anti-Blackness are the history of this country, as well as our ongoing and current reality. Through these words, I seek to honor and recognize the lives, knowledge, and labor of Black and Native peoples in the past, present, and future. So here's a picture of me looking chipper when I first arrived. You'll notice my hair is a little bit more gray now. I'm not saying that's, just the job. It actually had a lot to do with the pandemic, but yeah, super happy to be here. And so, like I said, it was an opportunity to reflect back on when I arrived, sort of what was I hoping to accomplish? A lot of people said, but if you were to think about 5 years from now and look back, what would you hope that would have happened? And what I answered to them at that time, which I still deeply believe, is that my primary goal as a dean is to incorporate best practices from the field of public health into the way that we run our organization, and that everything else sort of flows from that. And so when I say best practices from our field of public health, what do I mean? So the first of those is a deep appreciation for the members of our community as human beings. That really is a grounding belief and value for me, and I think one that's shared across the school. Part of that deep appreciation means that in the decisions that we make as a school, the priorities that we have, thinking about the well-being of the members of this community is just as important as thinking about the impact that we have on the health and well-being of people in the communities that we serve outside. Also, within public health, a core value is active engagement of stakeholders, and in particular, authentic engagement of those stakeholders early on in the process, right? So the important part here is that we want to leverage solutions that come from those individuals that are members of the communities that are most affected. So when we're talking about how to change our own organization, it's imperative to have those conversations as a school before we make decisions, and to make sure that we are lifting up the voices of the members of our community who may traditionally not have been heard. We also in public health focus on collecting data to inform decision-making, and then hopefully actually using those data to inform our decisions. We're also deeply committed to making those data widely available. So one of the things you're going to see today is me sharing some of that data that we've been collecting over the last 5 years. And then, of course, also assessing whether the programs that we've put into place are as effective as we had hoped, and making changes when we invariably find that there's room for improvement. So what I hope that you'll hear today is not just about what are the things that have happened over the last 5 years, but also I'm going to try and infuse those principles and best practices from public health into my description of how we went about accomplishing those things. I also want to take a moment before we get into the slides celebrating all of the wonderful things that the people in this room and other members of our community have done over the last 5 years, to acknowledge that we've lived through a lot of challenges and made it through those challenges together. A lot of the challenges had to do with living through the worst pandemic in a century and being part of the response and part of the voice that spoke out to surrounding communities and the world to say, here are the people whose voices need to be heard, and the approaches that should be taken when coming up with interventions. We've also been, as a community, continuing to struggle as we try and figure out what our new normal looks like. So I don't think we'll ever go back to working the same way and learning the same way that we did before the COVID-19 pandemic. But there's still this balance that we're trying to figure out between having flexibility and autonomy in terms of being able to determine your individual's working situations and what it means for the collective good in terms of gathering together. We've also struggled as a community with changing our own organizational culture and practices in the wake of the national racial reckoning that's been experienced. And I want to thank everyone who is engaged in what have been difficult, but really, really important conversations and being fully present for those conversations. They've made a huge difference in terms of the distance that we've been able to travel as a community and what we've been able to accomplish since then. Finally, I would be remiss if I did not address that we are going through a big period of change right now as well. It's in our own microcosm of the University of Washington. And some of you may say, I have no idea what you're talking about. And others will be like, oh, it's the worst, which is finance transformation. So I do want to acknowledge that finance transformation has affected many members of our community in ways that we did not anticipate that it would, and has challenged our ability to stand by our values of prioritizing the most vulnerable members of our community as we make decisions. I will talk about this more at the end, but I want to acknowledge it right up front that it's just been a really, really challenging couple of months for many members of our community, and to express my deep gratitude to the staff in our grants and contracts administration, in all of our financial offices, in centers, in departments, at the school, on the campus level, who have been really struggling on a daily basis with trying to make this work for all the members of our community. So with that, I'm going to shift and talk about some fun stuff. So I asked each of the departments to tell me 5 things, roughly. You'll see it sort of varies from department to department. Some highlights of the last 5 years. And then I had to cut because, man, we got these very lengthy lists and they were super impressive. So what you're going to see is my edited version of their even more fantastic list. So here from the Department of Biostatistics, I hope it goes without saying, but is really important to call out the incredible leadership that faculty, staff, and students within the Department of Biostatistics demonstrated during the emergency phase of the COVID-19 pandemic. They were actively involved in developing and demonstrating the efficacy of vaccines and boosters for COVID-19. We're at the front and leading edge of modeling efforts to track and predict the spread of COVID-19. They were instrumental in developing the WHO vaccine protocol and heading up WHO efforts to estimate excess mortality associated with the COVID-19 pandemic. And those are just a handful of the ways that they were engaged. In the midst of all that, they also launched a Master of Science in Biostatistics, which is a cool new capstone-based program that runs through C-Squared. And so I just feel like that's an incredible thing to acknowledge, is like in the midst of all that chaos and drama, like they were able to deliver on a really cool new program. As is the case for faculty in a number of our departments, faculty and students in the Department of Biostatistics, a number of them were recognized by very prestigious organizations for their contributions and their impact, and including election to the National Academy of Medicine for several of the faculty. And the department continues to be one of the highest ranked biostatistic departments in the country, and to continue to enhance its reputation for excellence and rigor. One thing that's super exciting in each of the departments is that they've hired new faculty, and biostats is no exception. So these are faculty who were hired through searches from 2018 that were conducted starting in the first full year that I was here, 2018, 2019. So people who started then, through people who were recruited in searches from this last year. And you're going to see these slides get very dense. And so I'm not going to call out everyone's name here. I just want to highlight that biostats actually, out of last year's searches, hired 3 new tenure track assistant professors, 2 of whom are shown here, Kevin and Guang Ho, and 1 who is not listed because he's starting in January. So super excited about the new folks joining the Department of Biostatistics. Some highlights from the Department of Environmental and Occupational Health Sciences. So they too were absolutely instrumental in terms of responding to the pandemic. Jen Otten and Adam Dranowski and their collaborators did incredible work looking at the effects of the pandemic on food insecurity, and also folks in DEOHS conducted work looking at effects of the pandemic on essential workers. And for any of you who remember from the early days of the pandemic, the fear that we all had about that brain tickling swabbing technique, we have DEOHS faculty, staff, and students to thank for their studies that showed that self-sampling and other sampling methodologies were equally effective. So we don't have to go through that anymore. In the midst of all this, they've been continuing their fantastic work advancing clean air research, including really important work partnering with communities near airports. They didn't list it here, but really, well, I guess the school kids part of it. I was going to say really great work with the school system, looking at impacts on farm workers and how different interventions worked. Just really, really fantastic work. And I would say both in the clean air research, but more broadly in DEOHS, as they highlighted here, just really working hand in hand with state agencies and also the legislature to make sure that we are addressing the needs of our state and our region and being really responsive to the studies that they, in the case of the legislature, that they feel would help to inform good policy making. I also want to call out that they have a couple of new centers. So they've launched both the UW Center for Environmental Health Equity with funding from the US EPA, and also a completely new center for disaster resilient communities. That's joint effort with the Population Health Initiative, and did incredible work developing the Washington Environmental Health Disparities Map. So, and that in combination with the new faculty that have been recruited within the Department of Environmental Health Sciences have really, we are now a powerhouse in environmental justice, which is such a fantastic thing. you're looking at this list and you're like, oh my goodness, look at all these people. It's going to get more dense than this on the slides to come. So out of all these people, I would love to mention them all. I'm just going to call out Karen Chen because she is the newest faculty member to join DEOHS, who's joining this fall, who was jointly recruited with urban planning in the College of the Built Environment, and gives thanks to search committee members who are in the room who helped to recruit her and all these other fantastic faculty. Some highlights from the Department of Epidemiology. So I would be remiss if I did not emphasize that one of the great things that happened in Epi in the last 5 years was they worked to bring back the use of tenure in the department. And you may think like, oh, well, that's a no-brainer, but it required so much conversation within the department to figure out how they would do that in a way that was consistent with the department's values and didn't leave members of their faculty feeling left out. So I just have to say huge kudos to them. This is an example of really, really challenging conversations that they manage really, really beautifully and have had really positive impacts. They also, in the Department of Epidemiology, have really led the school in terms of their work developing best practices and then implementing those best practices and disseminating them across the school, related to bringing an anti-racist framework and a social justice framework to review of our courses and curricula, and have applied that at this point, they say, to all EPI courses, which sounds amazing and fantastic. They also, along the same lines, have recently hired a student life cycle and community engagement counselor whose job is specifically to bring that same EDI sort of orientation to their student affairs programming within the department. As you can imagine, because COVID is what made epidemiology a household word, our epidemiologists at the University of Washington were really front and center in terms of media visibility during the emergency phase of the pandemic, but they've also been on the cutting edge and really present for a wide range of important emerging topics in the field of epidemiology, including, but not limited to, reproductive justice and firearm violence prevention and trans health. So just incredible work, really proud of the fact that they have really embraced that role, not only of doing the basic science, but really communicating out the results of that science to inform policy decision-making. And then finally, they gave this really lovely list of some really cool research accomplishments, which, let me just say, if I had had more time, I would have gone back to all the departments and asked them to do this, and they're probably going, darn it, why didn't we think of that? But I'll let you read them yourself, but they're super cool. And I do want to give a special shout out to Bud Kugel, who he and his team recently were successful in getting the National Alzheimer's Coordinating Center, or NAC, refunded, which was a big, heavy lift. EPI2 has been really active in recruiting new faculty. As I mentioned, they have restored use of tenure, so they've used some of those slots to what we call convert WOT faculty, existing WOT faculty to tenure track faculty. But they've also hired 4 new tenure track faculty in the department. And I also want to call out the newest member of the faculty, Hyunju Kim, who just joined this summer. So if you see her, be sure to say hi. Okay, next we have highlights from the Department of Global Health. So, like biostatistics, who in the midst of all of this COVID work and chaos, and really demonstrating incredible leadership, not just in terms of research, but also clinical interventions. Our faculty within the Department of Global Health also launched a completely innovative, amazing new doctoral program that's the only one like it in the world. It's called a Doctorate of Global Health, or DRGH, that is focused on global health leadership and practice. They currently have 17 students in that program that come from 11 different countries. And the first students to graduate from the program are expected to graduate this coming June. They also have launched a series of new initiatives, including the Global Cardiovascular Health Program, and where they jointly recruited with cardiology, Chris Longenecker, who's the director of that program. Connie Helm from DGH also saw huge success in getting the Center for AIDS Research, or CFAR, renewed, which I can't remember. I've meant to ask you, Carrie, like what the number of years is, but it's like one of the longest running funded centers. Yeah, it's a huge number of years. So really great, not surprising, but still really impressive accomplishment. And the Global Mental Health Consortium that was established in the last 5 years was also designated by the WHO as a WHO collaborating center, which is a huge honor. And then finally, I wanted to say, you know, these are a little harder to quantify and to come up with like a single bullet for them. But I really want to call out the work that the members of the Department of Global Health have done individually and collectively in leading conversations around decolonizing global health and having those really hard conversations about how to incorporate that philosophy into their own practices. I would say this is still a work in progress, but again, just having the conversations, having the honest and hard conversations is absolutely the first step towards getting there. Again, DGH, lots and lots of new faculty. I hardly know who to, oh, I know who I was going to call. I was going to call out. So DGH hired what I believe are their first ever teaching faculty in the last 5 years. And 2 of them are starting as brand new teaching assistant professors so Katerina Mucha started this summer and David Mukasa is starting, I believe, in December. So super exciting and just exciting to see global health sort of rethinking their models. So, but welcome to all of the fantastic new faculty. Okay, and last but not least, the Department of Health Systems and Population Health. So for those of you who may be thinking, wait a minute, what happened to health services? This is the old Department of Health Services. So their first, like, the big thing is, and I had sort of forgotten about this, but they changed their name. And I think it's been a really good change in terms of it really much more comprehensively includes the wide range of work that's going on in the department. And it seems to be embraced broadly by the broader community as well. They also launched the Center for Anti-Racism and Community Health, and we have our inaugural director, Wendy Barrington, here with us today. Betty, bless you for sending me like 50 billion bullets of like all the fantastic things that you have done. And I condensed it down here to the Northwest Center for Public Health Practice and the Health Prevention Research Center, both of which are based in the Department of Health Systems and Population Health. Both of them continue to be incredibly strong. Betty, huge thanks for the work that you've done, not just during the pandemic in terms of supporting the workforce, but also work that you've done as we sort of emerged from that emergency phase and thinking about what does our workforce need to look like going forward and how do we help train up that workforce. So thank you for your both strong and very impactful work. They also had 3 different programs get reaccredited by their individual organizations. And I didn't mention, but we as a school also got reaccredited in the last 5 years. Carrie, it's like, of course. And Shirley, who's here, like did like huge amounts of work for that. And Kimberly, who I saw here somewhere as well. Yeah, so anyway, I want to acknowledge that because those are also super heavy lifts. And I wanted to call out one of the things that Health Systems and Population Health has done as a department has been to really spearhead the use of holistic admissions processes for their graduate programs, and then helping to disseminate those practices out across the school. And as a result, have recruited just the most outstanding and diverse cohorts of students in their history. So really appreciative of that. And also some of the models that they've been developing for raising money for funding for students, which we're also emulating across the school. here are all the new faculty hired into HS Pop. I think I wrote down that, like, I counted, I think it was 9 new faculty starting this year. I'm going to tell you about a couple who are in leadership positions later on. And I'm not going to call out like specific people just because it was so many, but like, it's amazing. I have to say, like, so the other thing, like, that you may be wondering, like, 9 people in 1 year, what's going on? But part of it is HS Pop really coming to terms with, like, that trying to shift the philosophy of, like, focusing on hiring full-time faculty for some of our degree programs that have, at least in recent years, been more heavily dependent upon part-time faculty, and sort of rethinking the model for those programs. So I think that's a super exciting advancement, and also people coming into new leadership positions, which I am going to talk about later. So, okay, so if that sounds like a lot, it's because it is a lot. So we have hired more than 50 new faculty in the WOT tenure track and teaching tracks over the last 5 years. And that is a lot. It's a huge number in terms of like the percentage of positions in our school. And you are probably thinking, we must be growing by leaps and bounds. But that's actually just to keep steady with like the retirements and separations that we've had. So I do want to thank everyone, though. Almost everyone who's in this room has played a key role in helping to engage in the recruitment process and the selection process. This was a heavy lift, and it was a particularly heavy lift because about 3 years ago, we started really embracing implementing best practices for faculty searches, and which meant that they were even more work, but the result is really impressive. And so I just want to thank everyone who has invested that time, and in particular, just call out that, like, I feel like we're so well positioned for the future, looking at these incredible individuals that we've been able to recruit to this school. These are really the people who are going to be the future leaders, not only of our school, but of our field. They're doing super exciting, creative work, and we're just incredibly fortunate to have them here. Okay, the other thank you that I wanted to give was to all of the senior faculty and donors who have put in time and energy and money into supporting those new faculty and helping us to recruit them and make sure that they have the resources that and supports that they need to be successful once they get here. This is was just a lovely moment of the Maggie Ramirez being her installation celebration as the Dowling professor with Bill Dowling and India Ornelas, her department chair. So it's just one of the ways to support junior faculty. I know all of you have faculty who are in the room have engaged in countless other ways. This is a really, really challenging time for people to be starting in any profession because of what we talked about in terms of this weird, like, us trying to figure out, like, are we in person? Are we remote? Who's here when? And I have heard not just from our junior faculty, but from junior faculty across the 3 campuses, that one of the things that's hardest for them is that they're missing out on those sort of water cooler ad hoc mentoring conversations that were so common before the pandemic, and that we haven't really figured out how to like restart. So I just want to thank all of you who have recognized that that is a challenge and have made an effort to reach out to those new faculty. Barbara, I'm thinking of, like, you've done an amazing job, like, mentoring new faculty in the public health global health program, like so intensely grateful for that, but countless others as well. So yeah. Okay, as if that wasn't enough change, we've also experienced, again, I was sort of like, oh yeah, the new buildings. So yeah, we've experienced a lot of change in our buildings and facilities over the last 5 years as well. So this beautiful building that we're in right now, the Hands Roseling Center for Population Health, opened its doors in August of 2020. We all moved our stuff in and then went home for another year. But over the last 2 years since we came back, we've been sort of getting used to it and like realizing like what an incredible gift, what an amazing place to be. And that was made possible by a gift of over $300 million from the Gates Foundation. When I arrived in 2018, we had public health faculty, staff, and students in 20 different locations across Seattle. We're now down to 8, and we have about half of the population here in the HRC. So we're not all together, but at least what we have is this beautiful gathering place and hub and sort of center of mass. And hopefully with events like this and more opportunities for in-person gatherings, we continue to build that sense of community here and in our other locations. We also in 2022 moved into the new health sciences education building with the other 6 health sciences schools, other 5 health sciences schools. And that was made possible because of the state legislature providing $70 million to build that building. So if you haven't been to it yet, it's extraordinary and really beautiful. So definitely recommend going there. And then last but not least, our environmental and occupational health science laboratories have been renovated and upgraded. They're phenomenal. That is thanks to a really generous gift from Gil Oman and Martha Darling. And also just been absolutely instrumental in these 3 different projects really, again, position us just beautifully for the years to come of having just really good infrastructure. And in the meantime, are really, really beautiful places to work. Okay, so with that, I'm going to shift gears and talk about some highlights of things that we have done as a community across the school over the last 5 years. And I'm focusing on 5 things: the MPH Common Core, the strategic plan that we developed in 2020 and implemented, the faculty compensation plan, investments in research, and investments in people. So first of all, the MPH re-envisioning. So again, when I arrived in 2020, the faculty were in the throes of, I think it was maybe the 2nd or 3rd attempt to like revise the MPH core. And their goals at that point were that we would have an integrated core for all of our MPH programs that would meet the new CEF accreditation requirements. That was a huge, like, let's be honest, that was a huge driver for it. But we also wanted to make sure that we were continuing to prepare our students for the work that they want to engage in when they enter the workforce, and so that they were prepared to do that work and had the skills, competencies they needed to accomplish the change that they want to see in the world. We also, as we were having those conversations, really talked about one thing that's fairly unique about our school is this dual commitment to training researchers who appreciate practice and like want to make sure that they're doing research that informs practice, and practitioners who also value research. And that duality really played into the development of the new MPH core. I want to give special thanks to Steve Schwartz and Carrie Farquhar, who led the MPH re-envisioning committee. And not just for your leadership, but for the incredible way in which you engaged stakeholders across the school in that process. Shown here is just one of the many events. This was from, they had a series of open houses to sort of like run by people, like, here's what we're thinking, what do you think? But it really was just a really great example of, again, of like bringing best practices from public health to the way that we do things. So the result of all those efforts is the new MPH integrated core that was implemented in 2021. So we're now going into our 4th year of the new integrated core in our state-funded programs, and also was implemented in our online MPH program in academic year 21-22. It uses a co-instructor model. This has been challenging. It's hard, and involves 6 courses over 3 quarters, some of which have a small number of units, others have very large number of units. I want to particularly thank India Ornelas and Olivia Van Brunt, and all of the fantastic faculty who have participated in the Common Core over the last 3 years. They have really done an amazing job of bringing this vision, shared vision, to fruition. And in true public health way, they have the most amazing assessment and evaluation plan. So they do all this assessment and evaluation throughout the year, and then they get together regularly, get the instructors together regularly and talk about it. And they have a steering committee, and they all get together and they're like, here's what we found. And they make changes to the curriculum in response to that feedback. It's one of those moments where you're like, that's awesome. So really, really grateful to everyone who's been a part of that. I do definitely believe that part of the reason that we've been able to maintain really strong enrollments in our MPH program in recent years is because we made that leap forward and implemented the integrated core. So this is looking at total MPH enrollment as a function of year from 2013 to 2022. I need to show the national data, but what you don't see is nationally, there was a surge with COVID and then a pretty significant drop off. So we are one of the schools that has been pretty resistant to that trend. And I think it's in large part to this really, really fantastic core that's been implemented. We also have been monitoring graduation outcomes for our MPH graduates. And so here I'm showing you, so purple is, and this is a poll of recent graduates. Purple is people who reply that they're employed. Then the sort of gold is people who are continuing their education, either because they were in a concurrent degree program and they're doing the other part of it, or because they've gone on to a doctoral degree program, or for instance, medicine. The little grays are not seeking employment, which you can see hover around 1%. The actively seeking employment is one of the things that we really look to, and you can see that those have stayed between 1% and 3% over the last 3 years. That's really fantastic. And then the unknowns, which may look high here, these are fantastic rates of unknown. It's really hard to track down everybody. So I just have to say kudos to the team that's been tracking these students to get such complete data. The other thing that we're really proud of is when you combine the purple and the gold bars, that we have seen over 85% and up in the 90s percent of our graduates from the MPH programs who are either employed at the point that we're surveying them shortly after graduation, or who are enrolled in degree programs. So it's really fantastic. Stephanie told me I needed to show the same data for all our graduates. So I'm showing you that as well. Just full disclosure. So this is all our graduates, same time period, same kind of graph, graduate and undergraduate students. It doesn't look quite as impressive. Although she told me that I was oh, it looks like it's going down, but she said, no, statistically, we have this large unknown category here. So we're working, kudos to the folks who are still working diligently to track down those students. But we know we have a little bit of room for improvement there in terms of data collection. But we still see really great the combination of employed and continuing education across undergraduate, master's, and doctoral programs is really fantastic. Okay, next I want to shift to strategic planning. So I have to say, for me at least, one thing that has really helped me to navigate the near constant pressure of never-ending changes and emerging issues that we've been faced with over the last 3 years is having this strategic plan to turn to. It's really helped in terms of trying to figure out how to prioritize use of resources, but also just time and energy during a period when there's been a lot of times when I've just said to people, this is the year of doing less, or this is another year of doing less. Less is more. So really figuring out what things we absolutely need to do when we're short-staffed, when we're trying to do 3 different jobs, that's been really helpful. Consistent with public health best practices, the approach that we used for strategic planning was also one that relied on broad stakeholder engagement. And so shown here is a strategic planning town hall from 2019. And I particularly want to thank the consultants that worked with us, Pyramid Communications, as well as Jared Baton, who was Vice Dean at the time, but has subsequently gone on to work for Gilead Pharmaceuticals. And Kimberly Hay, who I haven't mentioned yet, but who not only staffed the planning activities, but has been absolutely critical in the implementation and all of our CEF reporting stuff. So really, really grateful. Okay, so the result of all that is this plan that I do really believe reflects our priorities as a community. And if you haven't done so already, I'm not going to go through the details of it because I feel like I talk about this every time I get up in front of the whole school. So if you haven't done so already, though, please go to the website, either using the 2D barcode or just the old-fashioned way, typing it in, because on the website are all, for each of the 5 different key result areas, it lists for each year of the plan, what are the milestones that the working group that's been working in each of those key result areas, what they've set as goals, and then what progress they made on those goals, as well as the results of surveys that were done in the first year and the third year, to sort of get a sense of how things, I lost my screen, come back to screen. All right, looks good. So the results of the surveys that we've done to get a sense of how the community as a whole is feeling about whether or not we're making progress on the goals that we set. Oh, I forgot to. I want to thank Stephanie Farquhar and again Kimberly for herding the Huskies on this one. We have great KRA teams, but you know, we're all busy. Everyone needs a little encouragement, so we appreciate you guys keeping us on track and making sure that this isn't another one of those strategic plans that just sort of sits on a shelf. It really has been a functional plan that has helped guide our work. Okay, I want to shift now to talking about the faculty compensation plan. So this was implemented in July of 2020. It was right as we thought the pandemic was going to be done shortly, right? And it was something that we had been working on pretty much since the time that I arrived. So when I arrived 5 years ago, I heard from many faculty that part of what was contributing to morale issues within the school was the sense that there were deep inequities in terms of both workload and compensation for faculty across the 5 departments. And in particular, our WOT faculty, who have the exact same appointment and promotion criteria as tenure track faculty, said that they were feeling more like independent contractors than like members of our community. So again, this is we used an inclusive process, engaging with our faculty senate, with faculty across the school, with our department chairs, other leaders, and developed this consistent set of expectations, both for workload and for pay, for tenure track, WOT, teaching, and research faculty. And as part of that compensation plan, provided 30% base salary support guaranteed for WOT faculty, whereas in some of the departments it had been as low as 5% prior to that, and 10% base support guaranteed for our research faculty. And also provided an explicit commitment to providing bridging support for our WOT faculty. And people constantly ask me, how are we able to afford that? The reason we were able to afford that is because we had seen this really tremendous, and continue to see this really tremendous increase in tuition revenue over the last decade. And that is largely due, let's see, I do have it, largely due to what you see in the purple down here, over time, increased enrollment in students who are matriculated in our undergraduate degree programs. So the gold are the number of master's students and the gray are the number of doctoral students. Those have stayed pretty constant, but underneath that is this sort of growing mountain of undergraduate enrollments. And that's important because it gave us money that comes into our core funds that come in at the school level and get distributed out to the departments that could be used to guarantee faculty support. So for everyone who's asked, like, why is it associated with teaching expectations as opposed to research expectations? That's why. The dollars that we're using for that guarantee came from teaching dollars. We did early on the first year, a little small survey asking whether people were happy with it, and then decided we would sort of back off and not do and make any changes for a while because we wanted to like sort of see how it went. So this is survey data of faculty. I think there were 250 some faculty who were surveyed and about 52% response rate, asking them whether or not they agreed with the statement that the new compensation plan makes them feel supported, with strongly agree on the far side to strongly disagree on the right side, and then don't know. And also whether or not they agreed with the statement that they felt that it was fair and equitable. I would say my take-home message from this, I was very happy to see that the majority of faculty who were surveyed agreed or strongly agreed, but there's still a large percentage of people who weren't sure or didn't agree. Or so I think to me that just brought up the questions of why. Why would, like, what are the things that weren't working or haven't been working now that we've had it in place for 3 years? And so what you're going to see in the coming year is us approaching all of you, asking you for much more detailed feedback. When I say all of you, I mean faculty, much more detailed feedback about what's worked, what hasn't worked, and where you might like to see changes. In addition, we're going to do some significant analysis looking at whether or not it's been implemented consistently across the department, since that was one of the major goals. And once we've gathered all that data, we will come back and engage with the faculty, including not just the faculty, elected faculty council, but also faculty across the school as well, to make some decisions about what tweaks might be put in place. Those tweaks would go into place for next academic year. We're not making changes for this year. So that's the status of the faculty compensation plan. I now want to shift to talking about investments in research. So it would be remiss of me not to say that research is an important and a really critical driver of the impact that we have within our school and the impact that we have on the world around us. We consistently are usually either second or sometimes third in terms of number of dollars brought in grants and contracts of schools at the University of Washington, where number one is always medicine. We are one of the big grant getting units on campus. We're also one of the top schools of public health in terms of grant dollars brought in. And what you can see from this plot, thanks to Jerry Cangelosi and the Research Council, who had many discussions about the best way to display, what data to display and what we make of it, is that although we've seen oscillations year to year in terms of, in blue, the number of grant dollars that were applied for, and in orange, the number of grant dollars that were awarded, that we see consistent increases in both of those. And I didn't include this slide, but I'm happy to share it with anyone who wants to see it. If you plot the success rate for grants, not in terms of dollars, but in terms of actual number of the actual number of grants, that stayed pretty consistent at about 30% for the school over the same time period, which is astounding. Like when you think about like what the funding rates are at NIH, et cetera, like 30% is fantastic. So I just want to give a huge shout out to like all the faculty, research staff, students, postdocs who have worked on research grants and have been working hard to bring in the money that funds that enterprise. I also want to thank the faculty who and staff who have been serving on the Research Council. This is something that was set up when Lisa Manhart was Associate Dean for Research and Jerry Cangelosi has continued as Associate Dean for Research. It's a group that meets regularly. They surveyed faculty and staff, and I believe students across the school, to come up with what were the priorities for how we would collectively invest in direct dollars to help support research. And as a result of that, developed what's called our research roadmap, which you can find on the website. And the investments that we've made are directly informed by that. So I want to call out a couple of different things. One is we've been incredibly successful in terms of providing trainings and supports for individuals applying for NIH diversity supplements. So that's been a huge success for this school. The other thing that we've been doing is providing pre-award support for faculty who are applying for training grants and or center and program project grant applications. And I'm telling you this right now because I'm hoping that some of you out there are thinking, I didn't know that. And now might be thinking, I want to get help and support for applying for my training grant application, which we all know is like a huge heavy lift, or program grant, project grant, or center grant application. So if you are in that camp, please reach out to Jerry, and Jerry will happily get you support for that. I also want to give a shout out to the collaboration between the Research Council and Wendy Barrington and the folks at Arch, who have been working on providing a series of seminars and developing tools for introducing anti-racist approaches to research, where Arch is, again, the Center for Anti-Racism and Community Health. So those are just some of the examples of where we've made investments. Finally, I wanted to talk about investing in people. So the people who are on my DAX class would be like, hey, she used that slide on us yesterday. And it's because I love this slide. This is from, like, Barbara, you may not remember this because this is probably before your time. Back in 2018, for dog days in the fall, the Public Health Global Health Program had a petting zoo. We need to do that again. You like, no, you don't think so? All right, we'll talk about it offline. Anyway, you can see, look how happy the people are with the petting zoo on the wallabies. Yeah, it has not all been petting zoos over the last 5 years. So as we talked about, man, like talk about a series of like stressful years, right? Investing in the people in our community has become even more important. You know, we are seeing increasing rates of mental health distress amongst, honestly, everybody in this country, but particularly young adults. We are seeing, you know, the conversations that we're having about anti-racism and how to approach our work with an anti-racist lens are critically important. They're also really hard and emotionally exhausting. And so that also requires supports for the people who are willing to engage in those and lead those efforts. And so I sort of turned back to where I started, which is our deep commitment to creating a positive place and positive culture for all the people who work here and learn here, and how we invest strategically in doing that and make sure that people have the supports that they need, not just to survive, but to thrive. So we see those commitments in our strategic plan called out in several places. One is the anti-racism through line that runs throughout all of our activities, and another is in our commitment to a collective culture of meaningful change. So I wanted to start by acknowledging the tremendous work that our EDI team has done in developing really innovative and phenomenal trainings in anti-racism, and that they have trained over 1,400 people over the last 3 years. This training was in direct response to, I wouldn't say request, a demand from students. So we were one of the first schools of public health back in 2016, I'm smiling at Amy Hagopian, to have a competency requirement for all students in all of our programs in anti-racism. And our students in 2020 rightly came back to us and said, you know what? The faculty and staff also need to have competency in anti-racism. And this training was the response to that. So thank you to all of you, faculty and staff, who have completed that training If you haven't yet completed it, good news is that it's going to be offered several times again this year. And so you'll see emails from myself and your department chairs urging you to participate. And again, I want to call out so that you can use the 2D barcode to go or just search for SPH, EDI, and anti-racism. They've done some lovely work assessing how people feel after, like before and after the training, and looking at knowledge gains as a result of doing the training. What's even more impressive is looking at longitudinally knowledge gains across our community of people who hadn't yet taken the training, but where we're seeing this amplification effect of having these open conversations and people engaging in this work more broadly. So in terms of the strategic plan and our KRA related to culture, one of the criteria that one of the goals that we set was to live up to our aspiration of having a student-centered culture. I believe these data are from 2021. Stephanie corrected me, but we have new data, which you could use that little strategic planning 2D barcode to go to the website and get the newer data, which looks actually quite similar to this, about looking at responses of different groups across our school to whether or not they agreed with the statement that this school has a student-centered culture. So shown here, faculty, so it's again, strongly agree to strongly disagree, and then on the far right, don't know. And then in purple, faculty, staff in gold, graduate students in gray, and then undergraduate students in beige. And what warms my heart here is when I look at our undergraduate students, the huge percentage of them that strongly agree or agree with the statement that they feel that we have a student-centered culture. And again, huge kudos. We have like a great contingent of student affairs staff here and folks from public health, global health, also our amazing food systems, nutrition and health, HIHIM, DEOHS undergraduate degree. People are like really invested in the well-being of our students, and our students feel it. And that to me is one of the best things. We also noted that like a lot of the staff entered, like the staff rates were lower because they didn't know, which totally makes sense because maybe they don't do student affairs stuff and so they don't know. But now you know, the students feel great. So that's really good. We also asked stakeholders whether they agree with the statement that the school maintains a culture of well-being and connection. And again, so exact same, strongly agree to strongly disagree, don't know, for faculty, staff, graduate students, and undergraduates. So again, here, we're seeing stronger responses, more positive responses from our students, which is fantastic. I'm super excited about that. What I would love to see 2 years from now is that our faculty and staff numbers look as good as our undergraduate numbers. And so you're gonna see us out here like trying to do like lots of like community building and like getting people engaged, and also thinking hard about how we support our faculty and staff through various different programs and professional development opportunities to try and really build that back. It's been a rough couple of years, and I think we're all feeling a little disconnected, but I would say there's definitely room for improvement here. So what are we doing in terms of investments? I'm really proud of us having had the foresight, and I think this was Juanita, who I don't see here, but like, bless her, to hire. We started advertising for this right before the pandemic hit, which meant we were one of the first schools to actually hire a mental health coordinator. We've been so fortunate to have Jen Wen in that position. And in addition, starting last year, we also added a position of an access and advocacy coordinator. What's key about both of these two positions is that they not only provide one-on-one and group services to our students, they're also running trainings for our instructional faculty and our student affairs staff on how do we create a culture that is more proactively supportive of our students' mental health and creates accessible learning environments. And I personally feel like I've learned a tremendous amount from the folks in both of these positions. But we also, hopefully it is also making our faculty and staff feel more supported as well. And like they have some good tools in their tool belt. We also implemented during the pandemic school-wide academic technologies TAs. I think this was Carrie's brainchild, because we had so many people struggling with the transition to online. We're revamping these and redeploying these people to help with artificial intelligence related stuff. So you'll see that in a slide that's coming up. And then last but not least, this has been led by Vice Dean Deepa Rao, but with input from lots of people and help from lots of people, has been working on developing what we're calling the faculty development program. Liz Kirk has also folded in a bunch of the work that was being done in terms of instructional professional development into this program, to really help, particularly so far it's focused on new members, new faculty, but then expanding that to make it available to all of our faculty. Really helpful professional development sessions on how to create an inclusive teaching environment, soft money skills, and then authentic community engagement. I also want to thank everyone who has contributed gifts to support our students over the last 5 years. In 2022, we launched the SPH campaign for students in concert with our 50th anniversary, and we raised more than $3.2 million in student support and had lots of first-time donors and really great participation from households. As part of that, and also in response to the pandemic, we established what we call the SPH Student Emergency Fund. This has been an incredible resource for students who have, like everyone else, been really impacted by just unprecedented change during the pandemic and just unexpected life events. The ability to provide them quickly with substantial financial support to help them navigate those issues has been really helpful. And just want to thank everyone who's participated in Husky Giving Day, which is relatively new for the campus, but we've been super active in. So thanks everybody. Okay, so finally I'm going to end up with what's ahead for academic year 23-24 and beyond. So first of all, we have lots of new folks in leadership roles. We are rolling out enhanced SPH IT supports and infrastructure. We are investing in Indigenous health. I'm going to talk a little bit about leveraging the power of AI, trying to put a positive spin on the AI turmoil. And then finally talk a little bit about the long-term financial planning that we're going to engage you in this year. So first of all, new folks in leadership roles. We have Neil Siegel up here in the front row, who is our new director of the MHA programs. Woo-hoo! And I thought did I see Michelle Averill? She was here earlier, okay, but she left. Okay, so Michelle has blessedly taken on the role of interim director for the nutritional sciences program. Likewise, Janet Baseman has taken on the role of interim chair for epidemiology. Derek Jennings, I'm going to talk about in just a minute, has taken on the role of our inaugural associate dean for Indigenous Affairs and Engagement. Brian Schertz is the new director for the Institute for Public Health Genetics. And Megha Ramaswamy, who has joined our faculty in July, will be chair of health systems and population health in January. I want to take this moment to give huge thanks to the people who were in these roles previously, many of whom were in the roles for a very long period of time, and some of whom were in interim roles for short periods of time. Just huge thanks for the people who helped provide stable leadership as we have brought in these new people. In terms of rolling out enhanced SPH IT supports and infrastructure, this is something that I alluded to probably the last time I gave a town hall. And so I'll remind you, we had this great committee task force that in February of 2022, which seems like an eternity ago, came out with this really, really rich set of recommendations around how we might provide enhanced SPH shared IT services. And one of their recommendations was, we actually need someone to lead that initiative. So now I'm really, really happy to say we have had the pleasure of recruiting Kevin Grimlinger, who's here in the audience, as our first Chief Information Officer, who will be working hand in hand with IT folks across the school on developing a detailed implementation plan and rolling it out. So lots of exciting stuff to come, and Kevin, super happy to have you. Kevin has already like saved me from like file disappearance, which is like such a small part of his job, but still very much appreciated. Okay, investments in Indigenous health. You're going to be hearing from me and also from Derek about a recommitment to the soul catcher. During the time that I've been here, I've heard loud and clear from faculty, alumni, of how much the soul catcher means to this community. I also know that things are changing in the world around us. The state of Washington passed a law that now K through 12 institutions that are not Indigenous serving institutions are not allowed to use Native imagery as their mascots. And so we engaged in some hard conversations about, was it right for us as a school that is not a Native serving institution to have the soul catcher being displayed in such a prominent way? And consultants that we hired came and said, you know, it feels like cultural appropriation. Maybe you should rethink that. And so I have to thank Sasacha Rossbrain, who is our former tribal liaison for the university, who put me in touch with Marvin Oliver's family. Marvin Oliver is the artist who developed our soul catcher, and he sadly passed away a couple of years ago. And Sasacha put me in touch with Owen Oliver, who is Marvin Oliver, one of Marvin Oliver's sons, who had just graduated from the University of Washington. And I told him about my conflicted concerns about this. And he said to me, so you feel like you don't deserve the soul catcher, and so you're thinking about giving it back? I said, yeah. He said, I think my dad would be really mad if he heard that. I was like, okay, talk to me about that. He said, you know what? If you feel like you don't deserve the soul catcher, you need to like earn the right to use the soul catcher. Don't just give up. And I really have taken that to heart. And have had conversations with Native faculty, staff, and students across our school about what it would mean to recommit to the soul catcher, to really like stand by the fact that we are proud to be associated with this beautiful piece of artwork. And so as part of that, I'm happy to announce that we now have an associate dean for Indigenous Affairs and Engagement. I'm thrilled that Derek Jennings has agreed to take on that role. And in particular, that he is willing to spend half of his time every day, every week, on really engaging deeply with Indigenous stakeholders, not just at our institution, but across our region, across the world, to ask them the questions of what would it mean to actually serve their needs? What would our programs look like? What would our research look like? Excuse me. So I really see this as the beginning of a new phase in our approach to how we engage with Native communities and the way that we approach our work. And Derek, just deeply thankful for your involvement and your leadership there. I did want to mention that we are also in collaboration with the School of Social Work launching a cluster hire for tenure track faculty in Indigenous health. So that's part of that effort as well. I promised I would talk about AI. So AI, I think for many of us, this has just been like a scary time. Students are probably much less scared, but for the faculty, we're just like, oh my God, everything's changing again. I have to say, I'm so deeply grateful. Is Jen Sliker still here? Did she have to leave? Darn, okay. Jen Sliker and Liz Kirk, bless you and everyone who served on the AI task force. In the spring, when the rest of us were like, wow, this looks really scary, the two of them were like, we're gonna get ahead of this. And they and their task force busted their butts over the summer and came out with really great concrete suggestions of how we should embrace the power of AI in our educational programs and in our research. They developed a training. So Carolyn Spice and John Hartgraves, bless the two of you for developing an amazing training for instructional faculty, which personally, like, I was like, at the end of it, I was not only convinced I need to get on board, but felt like I had some of the tools I needed to do it. And they are going to continue to offer that training in the quarters to come. They developed syllabus templates and options. And like I said, we're sort of converting our TAs over to helping on this as well. I'm also working with folks across the health sciences to develop some convening with partners on the future of AI and public health, healthcare, and health sciences. So that'll be more on the like research and just like what could the future hold and how do we make sure that we're at the cutting edge of that. But I would say suffice to say that we are trying to make sure that we're training our students so they are prepared to leverage this technology when they get out into the workforce, and making sure that all of you have the supports that you need in order to incorporate it and take advantage of it in your work. Okay, finally, last topic, financial planning. So hopefully you've gotten the message from what I've said before. Our core revenue from both grants, so indirect cost recovery, and tuition dollars is strong and has been increasing over the last decade. This puts us in a great financial position. However, with those sources of revenue come necessary expenses as well. And in addition, there are other expenses related to a myriad of different factors. And so we're taking a step back and saying, how could we engage more proactively in developing a longitudinal financial plan for the school? So here, I will step back into the murky world of finance transformation. So for those of you who have been trying to avoid thinking about finance transformation is absolutely necessary. Besides the fact that we don't have any choice about it, but like it is absolutely necessary. So finance transformation is the University of Washington switching from their 1970s system for financial monitoring and management that was written in COBOL into a modern system, right? So the central folks have been working literally for years on trying to get ready for it. I have to say, Liz Lancaster has done an amazing job as our representative, like going to these meetings for 2 years going, that's not going to work for us. That's not going to work for us. Could you change this? Could you anticipate that? And they really put a lot of thought into what might go wrong as we switch from like 900 different shadow systems into one integrated system, and trying to anticipate that and build in contingencies. And guess what? There were lots of things that they didn't anticipate. Because that's the way it works. It's like, we knew that was going to happen. They warned us. They're like, there are going to be things that we haven't anticipated. And there have been. So to name some of those for the school, some of the biggest issues that we have had, despite a fantastic preparation and team, just because they haven't worked in the new system, includes paying subcontracts. We really heard from, like, for instance, our subcontractees in low and middle income countries. They're being financially devastated by the amount of time that it's taking to pay those invoices. We're not billing funding agencies on time. Procurement is behind. And so I just want all of you who have been affected by this to be aware that, like, we have staff who are incredible, amazing staff who for years have felt like they're at the top of their game, who are now deeply frustrated because they don't have the ability to like move this system forward. So there's two different things that are going on. At the central level, we've pushed the communications about the problems all the way up the food chain. So president and provost are aware of them. And the FT transition team are working on trying to adapt the current, like the new financial system, so those things will work and there'll be automated systems for them. So we don't continue to have this problem going forward. So that's their job. What our folks have been stuck with is much less fun, which is the like manually dealing with all these like entries. And so it's just been a huge heavy lift, incredibly frustrating. And I just want to say thank you to all of them and hope that all of you who have faced frustrations also take a chance to like stop by and say thank you to people in contracts and grants administration at your unit and in the finance office and thank them because they're feeling pretty beleaguered right now. Okay, so that's the downside of finance transformation. Craig gave me this like picture of the tree and I was like, I kind of feel like we're like, I don't know if there's like something before that tree where like all the dead leaves are on the ground. That's where we are. But like we're getting there, we're gonna get there. So I want to introduce to you Craig Brownson, who's our new assistant dean for finance and administration. Woo, 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 woo. And man, Craig couldn't have arrived at a better time. Craig is like a wonderful, positive, competent human being and is like cheerfully leading us through this morass. And we're just really thrilled to have you here, Craig. So what's the plan? Like, why am I telling you about this other than to like acknowledge the deep suffering that's going on? The good news is we do eventually like hope to get to the point where we have that beautiful green tree. I don't know what the wedges are, but like it looks good. It looks so much better than where we are right now. So the whole goal of this system is that we could have visibility across the entire institution, both horizontally and vertically. And so for all those times that you've asked, what is Central doing with all the indirect cost dollars that they're keeping? They could actually answer those questions like going forward with the new system. We could even answer those questions. What are we doing with all of them, both at the school level and the department level? And we could do that for a bunch of different things. So the ability to like, not just budget, but actually look at how the actuals compare to the budget and figure out whether our budgeting was good budgeting and making adjustments is going to be so much better in the new system. Right now, we've been spending a lot of time on fixing like broken stuff. And so that has slowed down progress, not just for us, but I hear this from across campus on the sort of holy grail part of it that we're looking forward to, which is the ability to do forecasting and predictive budgeting. That has to happen though, in time for us to submit our budget to the provost's office in February. So you're going to hear us rolling out over the next couple months a plan. Craig, bless you, and bless everyone in all the departments who's working on this as well. A plan for how we're going to approach coming up to speed on that. We will be engaging faculty across the school. As we start to have more information, we will share it with you and engage you in that process. Right now, we don't have information for you, other than we are optimistic that we will get to a better place. So that's what the long-term financial plan is. Okay, so that is, other than please do continue to keep us posted. I won't say if, when you have problems that are due to the financial transition. I expect, people keep saying don't say a timeline. Hopefully we're going to see resolution of the current set of problems in the coming weeks, but there will be other problems that emerge. We're continuing to see them roll out new functionality, and as those new functionalities get rolled out, other things will break, right? So as much as you don't want to hear it's going to continue, we're going to continue to have issues. And so being super kind and patient with your financial folks and appreciative of them, I think is the thing I can most ask of you. And please tell Craig, myself, and Jerry, when you're having problems, don't assume that we know, because we continue to push up the food chain and continue to communicate that for us, one of our core values is making sure that our most vulnerable members of our community are not adversely impacted, or not, certainly not the most adversely impacted. So with that, I'm closing out State of the School Address 2023 and happy to answer any questions.